Getting to school is hard for students, especially when not old enough to drive themselves. The average morning commute for a high schooler was about 18 minutes, but some students' morning commutes are more than an hour, which is not a bad thing until health risks are brought into question. A study found that 1 minute increase in school commute times was associated with a 1.3-minute reduction in sleep, meaning that if a student had to commute 15 minutes longer than another student, they would be sleeping almost 20 minutes less on average. In December 2012, Secretary LaHood announced the American Indian and Alaska Native Tribe projects that were competitively selected to receive $15.5 million in FTA's Tribal Transit Program funds. The Cheyenne River Sioux Tribe, one of 72 tribes selected to receive funds, was awarded $350,000 to continue to provide public transit services to the growing number of tribal members and the general public who use it to travel to employment, education, medical care, and other services in Eagle Butte and surrounding rural areas. Accessible transit services is an equity issue because buses, trains, and other transit services provide the motorized transport necessary for social inclusion and for access to jobs needed for social mobility. Low-income populations that may or may not have access to car are put at a disadvantage in competing for jobs located more than a few blocks from home, even if they are fully qualified. Slower transit services also compound challenges on low-income families who need to chain trips to stores with work and transporting children to school and other activities. SAM, or the Sioux Area Metro, provides a safe and reliable transportation option for all who live, work, or play in Sioux Falls. The plan is for everyone in the Sioux Falls area to know they have affordable, reliable, and accessible public transit options. Whether they are commuting to work, getting to medical appointments, meeting up with friends and family, or heading to a local event. Looking at the world through a growing perspective and taking time is important. Although it may seem as though Sioux Falls is not doing much, it is important to know that they are taking into consideration the growth of the town and its changing transportation in determining if it is a need or if it is even achievable. This can be seen back in 1877. This prospect of having the railroad that had given Sioux Falls its growth has been called the wonder of the whole country. The newspapers speculated that the railroad would make the region flow to Sioux Falls and that this is what would bring still further growth. Between 2008 and 2012, the number of rural transit operators in the United States grew by nearly 6%, and 10% more trips are being provided, totaling 142 million trips last year. The department's Federal Transit Administration anticipates that demand for rural services will continue to rise, and we need legislative and policy solutions to deliver the transportation solutions that rural America needs. On July 6, 2012, President Obama signed the MAP 21 Act into law, reauthorizing public transportation and other surface transportation through the fiscal year of 2014. MAP 21 enables us to implement many bold new policies to strengthen and streamline public transportation. South Dakota is projected to receive a statewide allocation of $1.25 million under the Bus and Bus Facilities Program. These funds can be used anywhere in the state, including for projects in rural areas and on tribal lands. South Dakota's urbanized areas are projected to receive $385,882 in bus funds. These funds are allocated to the state, and the state can distribute them among the urbanized areas based on a locally determined process. The building of more highways has increased job placement because of the ability to travel to jobs instead of being stuck with the choices only 10 minutes away from home. This can be seen in early development of highways in the 1960s. 50% of MSA residents and 60% of MSA jobs were in central cities. By 2000, these numbers had declined to 23% and 32%, respectively, for the same geographic regions. The high spatial concentration of jobs means that while central cities lost residents, they gained jobs over time. The number of central city jobs increased by 14% between 1960 and 2000. Many models are always happening when looking at just how to improve transportation in general. For example, the transportation network design problem is an important component of traffic and transportation planning, and accessibility measure is a significant indicator for elevating the quality of transportation networks. Up to now, these two issues have been extensively studied in the field of transportation sciences during the past several decades, because the related problems are highly complicated, theoretically interesting, practically significant, and multidisciplinary. What can be done locally? You can dedicate more space and areas for more accessible public transportation with information about each structure available. State, you can launch campaigns for education on the transportation disparity and how to help lower problems that arise because of this disparity. This helps when there's transportation options, but not lots of knowledge about them, like in rural areas. National, you can fund and budget money specifically for transportation use. This can be through national campaigns or laws passed. Globally, you can spread news of ways to help and resources through TV or social networks. Also being able to provide and spread information about safe transportation like walking or ride sharing with friends and family if able. Transportation barriers can lead to rescheduled or missed appointments, delayed care, and missed or delayed medication use. This harms human health even though accessible, affordable, and reliable transportation is essential for everyone. In total, 61 studies were reviewed to state this. Overall, the evidence supports that transportation barriers are an important barrier to healthcare access, particularly for those with lower incomes or the under and uninsured. It was found that 3.6 million Americans missed their medical appointments due to no transportation, and 1 in 3 respondents experienced transportation barriers to healthcare between June 2020 and June 2021. Make that not be you. Pass on this information. All need to hear.